the human nervous system controls and coordinates every living tissue in the body. Okay, so there's over 40 trillion cells in our body that are coordinated by our nervous system. It's basically the control tower. We have the central nervous system and we have the peripheral nervous system. So we have the brain, the spinal cord, and then the nerves that go out to every living tissue that we have. Interestingly enough, here's a little trivia for you. The nervous system, every message coordinates with the brain at 0.02 seconds. That's how fast it is. So then we have two components of our nervous system. We have the sympathetic, which is the speed up or the fight or flight, and then we have the parasympathetic, which is the slow it down, right? And so our physiology can influence our sympathetic and our parasympathetic drive, all right? And then the production, the result of being over sympathetic or over parasympathetic, we're always in that continued state, which can create anxiety, and it can create depression, or it can create digestive issues, and it can create a lot of other things that manifest into disease processes. And then a tangent on that is like, okay, if you have a disease process, then the standard of care is just treating the disease process, like the hypothyroidism. We're going to give you a medication to speed up the process of your thyroid. And there's so many other influences that can happen. So that would be, a slowing down or a metabolic depression of the body, right? But going back to the nerve system, so if we have an overstimulation of the parasympathetic nervous system, we're creating a lot of glutamate. We're creating a lot of neurotransmitters that are always hyper excitable. If you're always in that state, then you're gonna create more issues for yourself, right? And then that starts to turn subconscious and unconscious. So it gets into what you call a limbic nervous system, which is your unconscious system, and that just takes over, right? And so that influences our actions and our reactions. But we can look at the body in a very specific way, and we can influence factors that are going to improve the functionality of the parasympathetic nervous system. So you're looking at cofactors, right? All these little nutrients are cofactors that influence the transition of your neurotransmitters, right? So you can move from a sympathetic state into a parasympathetic state, and how those neurotransmitters are going to fire. So glutamate gets suppressed and GABA fires, which is your inhibitory neurotransmitter. And so those are the things that we want to look at, because we want to create the building blocks. We want to do the things that are necessary for those reactions to happen, versus just mask an issue with a medication or try and influence a state of mental well-being by using a medication, and something that you're going to have to use for the rest of your life. So natural first, natural solutions for anxiety, natural solutions for depression, natural solutions for identifying overstimulation of the sympathetic nervous system, and natural solutions for improving the functionality of the parasympathetic nervous system. There's a lot that goes behind it, but those are the things at the surface. And it's about looking at all the body systems, and that's what we do through a functional health assessment, to see where some of the hang-ups might be and how we can start to approach, from a systematic standpoint, how to improve the functionality primarily of the nerve system.